something really quickly. I'm averse to toxic positivity. Okay, I'm averse to toxic positivity. Have you guys ever been in a situation where you're trying to talk about what your struggles are right now and your friend goes, yeah, well, that's life and blah, 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 blah. They're not trying to be dismissive or cruel. They don't have anything else that they can give you. They aren't telling you, like therapists tell you, this is an insurmountable task, but you are worth the labor you will put into it. We don't have that language. And so when somebody tells you, yeah, that sucks, they'll either do one of two really damaging things: talk about the time they were struggling and how they're fine, or talk about, yeah, this is normal, this is life, and be incredibly unhelpful.
Okay.
That's it. That's the problem.
Can I give you a comparison group? Okay. If we want to talk about marginalized groups and mental health care, that's something that I know a lot about. So like, if you don't mind, I want to make a comparison. Nobody would sit down and tell an Indigenous person that there isn't marginalization and systemic problems in the mental health care delivery and say it by saying, nobody's telling you not to go get therapy. Of course, people are saying Indigenous people can go get therapy. The issue is that typically therapists who treat them are white and have no understanding of their culture. And so there's massive cultural gaps that the client has to basically catch their therapist up on to even understand their worldview. There's also a lot of systemic stuff. For example, they might not feel comfortable with a white counselor or the institution itself because they've been actively harmed by this institution for a long time. When you look, for example, at incels, it is obviously not the level of oppression that Indigenous people have experienced, but they report very similar struggles. For example, their therapist typically is a woman who has no conception of their experience or the culture or the problems that they're coming from. And the humanities as an institution itself is deeply biased and hateful against these groups. And this is shown in the literature. It is shown in the research that's being done on these groups. So of course they're having a hard time finding good therapists. Their therapists don't understand their issues because most therapists are women who don't understand incels and feel uncomfortable with them, which is fucking fair, by the way. And also the actual institution itself doesn't care about this group and is actively villainizing them within research itself.
Okay, I do want to give